This presentation is on human immunodeficiency virus, or more commonly known as HIV, and the pathology of this disease and its implications. HIV was originally found in chimpanzees and was spread to humans in the early 1900s. The United States saw cases in the mid-1900s, and the first definitive case was in 1981. HIV is further broken down into HIV-1 and HIV-2. HIV-1 is more virulent. Eventually, HIV leads to acquired immunodeficiency syndrome, or better known as AIDS. AIDS is the most advanced stage where the body is weakened and the immune system cannot fight off organisms that are usually harmless. There was an estimated 38.4 million people with HIV in 2021, most of those being in the African region. Unfortunately, the African region accounts for 60% of all new HIV cases due to the lack of access to care, education, and high poverty rates. 1.2 million Americans are living with HIV. This number of prevalence is skewed because there are many people living with HIV that are undiagnosed. HIV costs $420,000 to $1 million, with an average of $501,000 per person over their lifetime. 650,000 people died from HIV cases in 2021. These causes are usually from opportunistic infections once the age stage is reached. 40.1 million people have died from HIV so far. We have come a long way in the decline of HIV, but still have a long way to go. Since the peak of HIV in 2004, there has been a 68% decrease in deaths from the virus in 2021. This table from the World Health Organization shows the total number of people living with HIV worldwide. It also breaks it down into gender and age group. Adults are more likely to get HIV than children, and more women than men are living with HIV. This is interesting because HIV was originally known as a homosexual disease. The majority of those cases were male-to-male transmission. Men are more likely to acquire HIV than women, and also way more likely to die from the disease. HIV can be spread via 3 different routes. These routes are bloodborne, sexual, and mother-to-child, with sexual being the most common route. The virus enters the CD4 plus T cells, dendritic cells, and macrophages. The 2 chemokine receptors, CCR5 and CXCR4, are required in order for HIV to infect the cells. After this, viral replication and proliferation occur rapidly. On day 3, HIV spreads to the lymph nodes, and by day 5, it spreads to the plasma. From there, it spreads to the bloodstream and organs. After it infiltrates the body, HIV attaches to the CD4 plus T cell receptors and delivers its RNA, which then converts to DNA. HIV increases replication and releases all viral DNA. It then continues to grow, and the body develops antibodies, all while the virus is usually not suspected or checked. There are 3 different stages of HIV. The first stage is acute, the second stage is chronic or clinical latency, and the third stage is advanced, which was formerly called the AIDS stage. During the acute stage, the person will experience flu-like symptoms, which include headache, chills, fever, rash, muscle aches, fatigue, and swollen lymph nodes. The symptoms are present 2 to 4 weeks after exposure and infection. Some people remain asymptomatic during this stage, and many do not get tested unless there is a suspected or known exposure. The chronic stage is asymptomatic, and the viral load is lower during this time. Most people stay in this stage for 10 to 15 years, however, it depends on the person. It can be shorter or longer, and it is also dependent on how early treatment is initiated. In the advanced stage, symptoms are more from opportunistic infections that enter the body. Some of these symptoms can be rapid weight loss, recurring fever, severe fatigue, mouth, anal, or genital sores, pneumonia, blotches in the mouth and nose, and the most severe neurologic disorders. This slide shows some pictures of how HIV and AIDS manifest. The pictures on the right are of a common cancer in people with HIV and AIDS, called Kaposi's sarcoma. There are quite a few ways to diagnose HIV. The gold standard used to be an enzyme immunoassay, or EIA, or an enzyme-linked immunosorbent assay, or ELI assay. Those were then confirmed by a Western blot assay. However, now HIV is usually diagnosed by an antibody or antigen test, which can detect the presence of HIV anywhere from 18 to 90 days after exposure. There is also a NATS test that can be done and is able to detect the virus 10 to 33 days after exposure. A polymerase chain reaction, or PCR, can be done to detect the presence of the virus instead of the antibody. This test is helpful in detecting the disease in infants who may not have HIV but have the antibodies from their positive mothers. Once a diagnosis is made, further evaluation is done to detect the stage of HIV and progression of the disease. There are multiple ways that HIV can be prevented. The most effective ways are to remain abstinent and not do drugs with dirty needles, but that is not possible for some. Using protection during intercourse, such as condoms, and using clean needles and following safety protocols if working in healthcare in order to prevent needle sticks is one of the many ways. If the woman is pregnant, she should continue taking medications to prevent transmission to the fetus. HIV is also spread in breast milk, so she should avoid breastfeeding. Pre-exposure prophylaxis and post-exposure prophylaxis can protect people that were unaware of exposure or who are actively involved with someone HIV positive. These medications have to be taken consistently and as soon as possible after or before exposure. Another way transmission can be prevented is to make sure that the partner has an undetectable viral load through medication. Unfortunately, there is currently no cure for HIV. Treatment is focused on the prevention of transmission, further disease progression, and viral load reduction. As soon as a diagnosis is made, antiretroviral therapy, or ART, should be initiated. ART therapy consists of taking multiple medications daily, all of which work on a different part in the disease pathway. Sometimes medications have to be switched if they are not working properly. Oral medications are started early on in treatment and can be switched to monthly injections later on. With proper treatment, an undetectable viral load is yielded, it cannot spread, and people have longer life expectancies. There's a lot of research into the cure for HIV, so hopefully one day we will have a cure. Midwives play a huge role in care of HIV patients worldwide. They especially have a huge part in countries where HIV rates are high. Midwives provide unbiased, judgment-free approach to managing health, especially during pregnancy. They are knowledgeable in treatment needs and options to safely care for the mother and baby during pregnancy, or for women with HIV outside of pregnancy. Midwives provide resources and support for patients with HIV and can help to integrate faith-based care if that is what the patient desires. In 2021, 54% of those with HIV were women and girls. During pregnancy, only 81% of women had access to and took ART medications. This is a pretty high percentage, however, it is not high enough to protect all infants from acquiring HIV from their mothers. On average, 4,900 females aged 15 to 24 are infected with HIV each week. Midwives are able to help protect mothers and babies by providing adequate care and education to their patients and the communities they serve. Midwives provide holistic care and are able to help patients during this difficult time.